Let's now go to stomach conditions. Let's discuss causes of stomach problems. The Neijing authors noticed that when the stomach function was weak, any of the following signs and symptoms could occur: nausea, vomiting, belching, sour regurgitation or acid reflux, hiccup, feeling discomfort or heat or coldness in the epigastrium or heartburn, discomfort over the ribs on the front, left side of the body, beneath which the stomach is situated, usually called indigestion. There are also bleeding gums or mouth ulcers, bad breath, either an unpleasant odor or a burned odor, and pain or discomfort anywhere along the stomach meridian. With all the above signs and symptoms, the treatment will be very similar and would involve the use of acupoints that strengthen the stomach function. Some acupoints are stomach 36, on the shin about 3 inches below the knee, Ren 12 on the abdomen about 4 inches above the navel, and bladder 21 on the back. When poor stomach function has been present for some time, these acupoints tend to feel tender when pressed, and stimulating such acupoints encourages the stomach to cancel out the malfunction in itself that caused the tenderness. The causes of stomach problems. Such problems often happen when a person has low energy in general, which is often due to them developing poor pancreas function or occurs after a long illness. And once this situation is reached, the person's eating habits will then play a big part. Any of the following habits may lead to a weakening of the stomach function and the occurrence of the above signs and symptoms: eating too quickly and not chewing food sufficiently, eating too much at one sitting, or not eating enough in general, such as when dieting, eating foods that are hard to digest, such as any cold or raw foods, and being emotionally upset when eating. Avoiding such habits would help the patient to avoid developing stomach problems. But more importantly, any weaknesses that make the patient prone to stomach problems should also be addressed, such as poor pancreas function. Finally, as with all the organs, the stomach function can also be impeded due to mental and emotional factors. Any sustained situation in our life that we find hard to stomach could have this effect. In other words, when we are unable to start to mentally digest a factor situation, this failure is duplicate in the stomach and impedes its ability to begin the process of digesting food. Here we have a patient example, a male, aged 14. The patient's parents split up when he was age 10, and a year later he developed stomach cramps. His elder brother then left home to attend university, which he also found hard to accept. This case was a clear example of disruption of an organ's function due to emotional factor. He found it hard to stomach these circumstances, which then impeded his stomach function. The knowledge of this particular cause and effect has become so clear to people over the centuries that it is now fossilized in the very language. There is no doubt that this is the origin of such expressions as finding something hard to stomach, or having no stomach for something, or something that makes you sick, where such emotions or ideas produce physical symptoms in the stomach, such as pain, nausea, or indigestion. Thank you for your attention.